When I'm treating crow's feet wrinkles, I like to start with Botox, and I will place my first drop in the upper outer area of the brow. As we age, we start to see the wrinkles that form in the upper brow area. So when my patient raises her brow and holds, then you can see the wrinkle that wants to form. So this is a line of expression versus a static line. So my first drop of Botox is going to go in the upper outer brow, and I go right inside the tail, right there. That's going to do two things. That's going to relax this wrinkle, and it's going to spread about the size of a dime. So I'm going to get a nice wrinkle relaxation through here. But it's also going to cause the untreated area here to lift just a little bit. So you'll get a tiny bit of an outer brow lift as well as a wrinkle relaxation, which is a beautiful combination therapy. My second Botox application is going to be right here. So if I draw a line from the outer corner of the eye out, I'm going to see almost an imaginary V, and I want my next drop to go right in the peak of that V. That's going to give me a nice mid crow's feet spread for wrinkle relaxation. And then my third drop is going to come down to what I have coined the smile swoop. So when you smile, you can see these lines start to drop off, and I go to where the edge of those wrinkles are with a smile swoop, and I'm going to put one little drop right there. I've got 1, 2, 3 drops that I'm going to use to treat. Now, the injection direction with Botox around the eyes is really important. The angle of the needle. Sometimes I'll see people injecting at a 90-degree angle. That is a surefire way to give your patient a horrific black eye. You're also not going to get a very good spread of neurotoxin when you inject at a 90-degree angle. The other thing that I see injectors doing that I cringe at is I see them reach across the patient and inject this direction away from the eye. You have no control over where your neurotoxin is spreading. So I teach my injectors you're going to go up and in and in. There's a whole myriad of techniques, tips, and factual strategies that I'm using when I'm treating the eye area. And it's so crucial to have a firm understanding of every single one of these for your patient's best outcome.